Hello there, my name is Neil Schloth and I am a Senior Information Technology major at Hofstra University. The following presentation, prepared for the course IT 142, entitled Healthcare Information Technology and Security, focuses on data warehousing with a concentration on its applications in the healthcare industry. The presentation will be divided into 5 subsections, including an introduction to data warehousing, healthcare data warehousing in the bus matrix, improved security through information security governance, disaster recovery strategies through enterprise data warehousing, and emerging trends in the healthcare data warehousing industry. So through an analysis of these 5 topics, we will come to acquire a better understanding of data warehousing, along with its applications and implications on the healthcare industry both now and in the future. According to Cengage's learning textbook by Bidgoli, entitled Management Information Systems, version 2, a data warehouse is a collection of data from a variety of sources used to support decision-making applications and generate business intelligence. Typically, data in a data warehouse can be differentiated from data in a database in that they are 1. Subject-oriented, meaning that they are focused on a specific area such as home improvement, business, or a university, whereas data in a database is transactional or function-oriented. Second, data is integrated, in that data comes from a variety of different sources rather than only one. Third, data is time variant, so it's categorized based on time. Fourth, the type of data, such as the captured aggregated data rather than raw transactional data. Fifth, and finally, is the purpose, meaning that they're used for analytical processes rather than capturing and managing transactions. Additionally, the processes through which information is processed through a data warehouse is known as ETL. These 3 stages include extraction, meaning the collected data from a variety of sources is converted into a format that can be used in transformational processing. Transformational processing occurs to make sure that the data meets the data warehouse's needs, such as only selecting certain columns or rows to load, and sorting or filtering through loads of data. And finally, loading is the process of transferring data into the data warehouse, either by overriding existing data fields or adding collected data. With a better understanding of how these complex data warehousing systems are managed, we may now begin to see how its application as a tool for the healthcare industry will be used going forward. As noted by Kimball and Ross in the Data Warehouse Toolkit, healthcare organizations must leverage information more effectively to improve patient outcomes and operational efficiencies. However, these organizations must concurrently also wrestle with overwhelming complex government regulations, such as HIPAA, challenges integrating administrative and clinical systems, and internal pressures to better manage costs and risks. It is up to healthcare analysts to identify those opportunities to improve resource utilization of labor, facilities, equipment, and supplies. Only through collecting data from the networks of physicians, clinics, hospitals, pharmacies, laboratories, and all others involved can providers assume more control in improving the quality and cost of their respective healthcare services. The following illustrates an example of a healthcare organization's bus matrix. The bus matrix purpose is one of high abstraction and visionary planning on the data warehouse architectural level. By dictating coherency in the development and implementation of an overall data warehouse, the bus architecture enables an overall vision of the broader enterprise integration and consistency, while at the same time dividing the problem into more manageable parts, all in a technology and software independent manner. While consolidating as much information as possible can lead to smarter systems through data warehousing, the issue of security is one of high value and consequence. As documented by Johnson and Hale in Communications of the ACM, within the modern hyper-connected business landscapes are constantly under cyber attack. According to the 2005 Computer Crime and Security Survey, conducted jointly by the Computer Security Institute and the San Francisco Office of the Federal Bureau of Investigation, 56% of respondents reported unauthorized computer system use during the past year. These unauthorized uses included malicious attacks, such as theft or destruction of intellectual property, insider abuse, and unauthorized access to information that results in a loss of data integrity and confidentiality, as well as malware threats such as viruses, spyware, worms, and Trojans. Based on responses obtained from a sample of 700 security practitioners from the government, financial, medical, business, and higher education institutions, The most frequently reported forms of malicious attacks were virus attacks and insider abuse at a reported rate of approximately 75 to 50% respectively. Within the realm of the 639 respondents willing to estimate losses due to threats, the total cost associated with virus attacks were determined to be approximately $43 million, while insider abuse costs were nearly $7 million. While these figures are an improvement over past years, clearly many firms still operate ineffectively through information protection programs. Given the extreme sensitivity of medical data, it is essential that these systems include more secured access and more effective measures to prevent data theft or corruption. Through such a system, fulfilling 2/3 of the areas of IT security, those two being security, secrecy, and integrity, it takes a disaster such as Hurricane Katrina to demonstrate the importance of the third and final security component, necessity. Hurricane Katrina had a major impact on healthcare in the affected and surrounding areas. Thousands of evacuees, including many who had chronic conditions, needed immediate medical care. The situation was perhaps the worst for those who left home without medical records, medications, or other criminal information. Clinicians and healthcare providers from the neighboring areas were forced to assess and treat unfamiliar patients without the help of electronic patient records. As proposed by the authors of the article, Disaster Response in Healthcare, a design extension for EDW, enterprise data warehousing would provide a solution to access information during times of such emergency. EDW, or Enterprise Data Warehousing, is developed to meet the needs of strategic decision makers that operational data sources and systems, such as online transactional processing, by design cannot support. Particularly, an EDW is considered a source of informational data to aid strategic decision making rather than operational data for supporting day-to-day business operations. While traditionally developed for strategic decision making, this opportunity presents an architectural extension for EDW that can potentially help healthcare providers continue their services during and throughout the aftermath of a large-scale disaster such as Katrina by providing operational data when and where it is needed most. Thus, we have the tools to build such functional systems today, and going forward, however, the potential applications of data warehousing throughout healthcare could provide for more astonishing healthcare technologies, more than we've seen ever before. As outlined by Richard Watson in his book, The Future, 50 Big Ideas You Really Need to Know, areas of healthcare technology once seen as science fiction could soon be a reality. Personalized genomics could be realized with the help of 23andMe, a Google-backed biotech company now offering personalized genome sequencing for only $99, as compared to $10,000 only a decade ago. Regenerative medicine will now allow individuals to live longer, healthier lives through preventative stem cell therapies, 3D-printed synthetic organ fabricators, and the proliferation of medication and vaccinations on a global scale. Remote monitoring already exists to some degree with recent innovation in wearable technologies, though integration with clinical information systems has yet to be seen. Patches, bracelets, or bandages with embedded sensors could be worn by patients to track information such as heart rate, body temperature, or blood pressure in real time. This could thus enable a big data revolution in the management and storage of personal medical records across cloud networks. User-generated medicine operates by providing individuals with the information they need to solve medical issues as they arise. Similar to any rating system for products or services on the internet, users can provide feedback or advice for others based on their own past experiences. One great example of this application is WebMD, which provides individuals with health information services via mobile smartphones. Finally, medical data mining will allow us to analyze large sets of health information to make smarter, more informed decisions about how to manage complex systems across the planet. Thus, the applications and implications of data warehousing systems in the healthcare industry are vast, with limitless potential as technologies of the future continue advancing. However, the key to successful implementation and design will always include the three fundamental components of security: necessity, secrecy, and integrity. Through secure systems and innovative technologies, data warehousing in healthcare will revolutionize how we live our lives both now and in the future. I thank you for your time and hope you enjoyed this presentation.